My name is Audrey Obara, Senior Investment Manager in Healthcare at Swedfund and Head of Regional Office in Nairobi. Today, I'd just like to talk briefly about the COVID situation in Africa and in East Africa and how it is affecting the people in Africa and how it's affecting the way we do our work. In Kenya, where I live, we have had a lockdown within certain parts of the country. So one of the initial measures that was implemented in Kenya was a curfew, and this curfew was between dusk to dawn curfew. You have to be in your house by 7 p.m. and then you can leave at 5 a.m. What this essentially meant is that the business day for most companies and traders was reduced, and then also restaurants and bars were not able to open. People are urged to stay at home, work from home as much as possible. But I think it's worth noting that working from home is a luxury, and very few people actually can work from home. Many people rely on daily wages, living hand to mouth, making $5 a day or lower. And if these people cannot go out to work, then it is difficult to find money to feed themselves and their families. Many people in Africa have daily jobs. What that means is that if you work, you earn. You go out to a construction site, or you go to someone's home, or you go to a factory where you're employed part-time. And if you don't show up for work, you don't earn anything that day. Typically, people would earn anything from $5 to $15 a day. But it's really a daily wage. There's no form of security if you fall sick and are not able to go to work. There's no insurance or pension. There's no medical insurance attached to that. So for many people, having a job really means having food on your table at the end of that day. So there are most people are informally employed. There's a study by McKinsey that says Africa has about 450 million jobs. 85% of these jobs are in the informal sector and SMEs. So people who are self-employed, about 45%, and then 40%, is SMEs. Now, these are the jobs that have been affected the most by lockdowns and curfews and general slowdown in the economy. It is estimated that a third of these 450 million jobs in Africa are at risk because of COVID. That's 150 million jobs, quite a huge number of jobs. And further estimates are that some of these jobs, even after the COVID pandemic, will be lost completely. So even in the formal sector, we have seen situations where, because of social distancing and staying at home, business has slowed down. Staff don't have work or have little work. There's reduced work, so people have been asked to take reduced salaries, take some leave. So it's very important for development finance institutions like Swedfund, who are working to create jobs, to continue to support portfolio companies to continue to sustain jobs, because this is the most direct impact on people. If you don't have a job, you will not be able to buy food, you will not be able to afford healthcare, you will not be able to take your children to school. Many countries do have some form of free education, but then even with free education, you still need to buy books, you still need to buy uniform. So there's still a lot that individual needs to pay. So the creation of jobs, the protection of jobs, is very, very important matter in this situation. Very early on, when WHO declared COVID pandemic, we reached out to our portfolio companies in healthcare and asked them, what can we do to support you? And one of the areas that was quickly identified for healthcare companies was PPE, how to protect their personnel. So we've been able to process quite a number of applications to support our companies. We've disbursed funding to quite a number of our companies already. And I think this has been very quick on Swedfund's part, being a small organization, being able to make decisions very quickly. On a longer term basis, we are looking at company-to-company basis, how can we support the company to ensure the continuous survival of the company so as to protect jobs. We have explored or are continuing to explore using different instruments. It could be additional investments into the company. It could be moratoriums on interest payments that were to be made if it was a loan facility. It could be equipping staff with certain skills. So we are working very closely with our portfolio companies to make sure that we can support them during this pandemic, because there's still a lot to come. We don't know what shape or form it will take, but we are there to support the companies. So one of the questions we've been, having discussions with in different forums is what is the most critical thing right now? Is it jobs? Is it healthcare? And I think it's both. But jobs do take prominence, because if you don't have a job, then you don't have access to food, and if you don't have food, then your healthcare is at risk. And I think if there's more focus to do things also for ourselves internally in Africa, that also will create jobs, and then would be a stimulus to revive the economy faster.